She grabbed the scalpel from the resident's trembling hand and made the cut herself. No hesitation, no explanation, just one clean, perfect incision, while blood flooded the table and every monitor screamed. She was a nurse. She was supposed to hand the instruments, not use them. What no one in that OR knew, what no one at St. Jude's Memorial had ever thought to ask, was that Camille Renner had once been a major in the U.S. Army Medical Corps, a Johns Hopkins-trained trauma surgeon who had operated through firefights in Afghanistan. Over the next 3 hours, she would perform 5 surgeries. All 5 patients survived. Then the chief of surgery looked her in the eye and asked the question that would unravel everything. Who are you really? If this is the kind of story that stays with you, subscribe. There's more coming, and you won't want to miss it. The storm had been building since noon. By 8 o'clock that evening, the temperature outside St. Jude's Memorial Hospital had dropped to 11 degrees, and the wind was driving snow sideways across every window on the east face of the building. The staff on the overnight shift had come in early, knowing the roads would be impassable by midnight. Nobody expected to need that extra time. Then the call came in from the highway. A tanker truck had jackknifed on the I-90 near the Cicero Avenue overpass, and the cars behind it had no time to stop. The chain reaction swallowed nearly 60 vehicles in under 4 minutes. By the time the first ambulance reached St. Jude's, the emergency department had already shifted into mass casualty protocol. Gurneys lined the corridors. Monitors beeped from every bay. The triage board filled up faster than anyone could update it. Dr. Bennett Ralston, chief of surgery, moved through the chaos the way he always moved, with the particular kind of authority that doesn't ask permission. At 51, he had performed over 4,000 procedures, trained residents across 3 hospital systems, and built a reputation for precision that bordered on legend. He also had a way of looking at people that made them feel like furniture. Useful occasionally, replaceable always. That was especially true of nurses who, in Bennett's operational worldview, existed to hand things over and stay out of the way. Tonight, his 3 senior surgeons were unreachable. The storm had seen to that. Dr. Celeste Monroe was stuck on the expressway somewhere past Oak Park. Chase Ellison hadn't made it in from the suburbs at all. Bennett had left 2 voicemails and stopped trying. What he had instead were 2 first-year residents, a battle-worn anesthesiologist named Martin Ellery, and a short-staffed OR team that had already been on shift for 9 hours. Martin was the kind of man who got calmer as situations got worse, which made him either very good at his job or very skilled at hiding fear. Bennett had never asked which. Tonight, Martin was cycling between 4 pre-op bays, adjusting drips, checking pressure readings, and saying very little. That silence was the thing that told Bennett how bad it actually was. The 2 residents were a different problem. Gavin Reese had the textbook knowledge of someone who had studied obsessively and the instincts of someone who hadn't been tested yet. He asked excellent questions during rounds and went quiet when the answers mattered. He knew theoretically how to perform an exploratory laparotomy. He had watched it done 16 times. The problem was that knowing and doing lived in completely different parts of the brain, and Gavin had never been left alone long enough to close that distance. His weakness wasn't ignorance. It was the inability to act without someone behind him confirming he was right. Sabrina Knox was almost the opposite. She was fast, decisive, and relentlessly confident, qualities that looked like competence right up until the moment they became dangerous. She had never learned to treat uncertainty as information because uncertainty felt too much like failure. Where Gavin might freeze at the edge of a decision, Sabrina would step off it without checking how far the drop was. Both tendencies could kill a patient. Tonight, they might do exactly that. Camille Renner had worked alongside both of them for 8 months and had quietly formed her own conclusions about each. She kept those conclusions to herself the way she kept most things filed away behind a composure so consistent that people had stopped looking for what might be underneath it. She was 34, had transferred in from a hospital downstate the previous spring, and had developed a reputation in the OR for being exceptionally good at a job that no one thought required much skill. She anticipated instrument requests before the surgeons made them. She caught labeling errors before they reached the patient. She worked double shifts without complaint and never once raised her voice even when Bennett was at his worst, which was often, and which she absorbed without reaction every single time. To Bennett Ralston. Camille Renner was the woman who handed him things. 5 critical patients arrived within the same 20-minute window. All 5 were beyond what any emergency department intervention could hold. A man in his mid-40s had blunt abdominal trauma with internal hemorrhage. His pressure was dropping, and his abdomen was distending visibly. A young woman in her late 20s had taken a dashboard impact to the chest. Her left lung was compromised, and her breathing was already shallow and wrong. A third patient showed signs of intracranial pressure from a head wound that was building toward catastrophic. 2 others had vascular injuries racing against their own blood supply. All 5 needed the operating room. All 5 needed it now. Bennett looked at the board, ran the math that no one wanted to say out loud, and made his call. He would take the aortic rupture in operating room 1, the case that required his exact level of experience. It would take 3 to 4 hours if everything went well. He assigned Gavin to the abdominal hemorrhage in operating room 2 and Sabrina to the chest trauma in operating room 3. Operating rooms 4 and 5. The intracranial case and the femoral vascular injury he flagged as critical and unassigned, hoping Martin could stabilize them long enough for the neurosurgeon on call to fight through the storm. He gathered the 2 residents in the hallway outside the OR suites. He was brief. He told them which rooms they were assigned, to which patients were theirs, and what needed to happen. He said it as though he were delivering information to competent professionals who simply needed the relevant facts. Gavin said it straight. He wasn't sure he could perform an open abdominal exploration without supervision. He said it quietly, without making it dramatic, because that was how Gavin did things. He was telling the truth about his own limitation, which required a kind of honesty that Bennett had no patience for. Bennett grabbed the front of Gavin's scrub top. He brought his face close enough that Gavin had to work to keep his expression steady, and told him that if he walked out of that OR without a living patient, his career at St. Jude's, and very possibly his career anywhere, was over. He let go, turned, and walked into operating room 1. Sabrina said nothing. She adjusted her mask, leveled her chin, and moved toward operating room 3 with her hands loose at her sides, every inch of her posture communicating that she had this handled. She didn't look back. That was the part that worried Camille most. Gavin stood in the hallway for a moment longer. He took a breath that didn't do what he needed it to do and walked toward operating room 2. Camille had been standing at the scrub sink through all of it. She was washing her hands with the mechanical focus she brought to every task in this building, watching without appearing to watch, a skill she had spent years refining in environments where being overlooked was sometimes the only advantage available. She saw the way Gavin's jaw had tightened after Bennett released him. She saw which direction Sabrina had moved, and how fast. She noted that OR4 and OR5 had no surgeon and no plan. She ran through the numbers the way she always ran them, quietly, without letting the conclusions show on her face. She finished scrubbing and followed Gavin into operating room 2. The patient was a 46-year-old man named Daniel. She knew that from the intake sheet she had reviewed at the nursing station before any of this had fully escalated. His abdomen was swollen and discolored, a deep bruising purple spreading outward from the center. His blood pressure on the monitor read 81/50 and was still moving in the wrong direction. Gavin stood at the table with the scalpel in his hand and his eyes fixed on the center of Daniel's abdomen. He knew exactly where the incision needed to go. He had drawn the line in his mind a dozen times in the last 2 minutes. But his hand wasn't moving, and the monitor wasn't lying, and every number it displayed was getting worse. Martin called the pressure from across the room. Gavin's grip tightened on the instrument without moving it an inch. Through the shared wall, Camille could hear Sabrina's voice in operating room 3, controlled certain and slightly too fast. She was doing something. Whether she was doing the right thing was the question Camille had been sitting with since the moment she watched her walk away. The monitor above Daniel showed 78/47. There was a version of this moment where Camille did nothing, where she stayed in her assigned role, where she waited for the surgeon to act, where she let the structure of this institution decide what happened to the man on the table. She understood that version. She had been living inside it for 8 months deliberately because the reasons she had built that life were not small ones. She had built it carefully, and it had cost her something real to build it. But Daniel's color was wrong. The number on the monitor read 74/44, and Gavin Reese was not going to make that cut. Camille set down the retractor she was holding. She stepped around the table, reached out, and lifted the scalpel from Gavin's hand. Not pulling, just taking it with the quiet authority of someone who had performed that exact motion more times than she could count. She adjusted her angle, found her position, and drew the blade in one clean, certain line down the center of the patient's abdomen. The incision was perfect. Gavin stared at her. Martin stared at her. The scrub tech in the corner went completely still. Camille's voice came out low, and even the same register she used for everything in this building, except that underneath it for the first time, something else was audible. Something that had no business existing in a nurse's tone. She told Martin to push 2 units of packed red blood cells and run a vasopressor at the rate she specified. She told Gavin to take the suction and keep the field clear, and she said it in a way that left no room for any question that wasn't about the patient. Then she looked at what was inside the cavity. The splenic artery had torn at the hilum. The hemorrhage was severe, pooled deep behind structures that would have taken a less experienced hand several minutes to navigate. Camille navigated them in the time it took Martin to confirm the blood was running. She placed the clamp by feel as much as sight, threading it into the operative field with a spatial certainty that doesn't come from a textbook, that comes from having done this in conditions so much worse than a well-lit OR in Chicago that this, by comparison, almost felt controlled. The pressure on the monitor began to climb. 79, 84, 91. Gavin watched her hands move and said nothing. He would think about them for a long time afterward. Not just the technique, but the quality of certainty behind every motion. As if her hands already knew the answer before the question was fully formed. Camille kept her eyes on the field. There were 4 more patients in 4 other rooms, and she already knew she wasn't finished. Daniel's pressure held at 93. It wasn't safe, nothing about the next several hours would be safe, but it was enough. Camille told Gavin to ligate the vessel at the proximal point she indicated close in layers, and not deviate from that sequence for any reason. She said it the way someone gives instructions to a person they are trusting with a specific task, not talking down to him, but also leaving no room for improvisation. Gavin nodded. His hands, she noticed, had stopped shaking. She didn't know if that was because she had steadied him or because he had found something to hold on to now that someone else had made the first decision. Either way, she needed him functional, and he was functional. That was enough. She stripped off her outer gloves at the door and was already moving when the overhead panel for operating room 3 lit up red. Cardiac arrest. The room she walked into had the particular stillness that falls over people who have just watched something go wrong and haven't yet decided what to do next. The patient, a young woman mid-20s with a chest impact injury that had been borderline survivable, was flat on the table. The monitor showed the flat, rapid oscillation of ventricular fibrillation. Sabrina was standing 2 feet from the table with a chest tube in her hand, and the expression on her face was not panic. It was something more specific than panic. It was the look of someone who had just understood for the first time the exact distance between confidence and competence. The tube was in the wrong intercostal space. The angle was wrong. The trapped air and blood pressing on the patient's heart had nowhere to go. Camille didn't say anything about what Sabrina had done. There was no time, and more importantly, there was no point. She took the instruments she needed, identified the correct entry point on the left lateral chest wall, and opened it. The release was immediate, a rush of air and dark blood that told her the pericardium had been under sustained compression. She placed the drain, confirmed the position, and called across the room to Martin to charge the defibrillator. 2 shocks. The second one caught. The rhythm on the monitor returned irregular at first, then settling into something that resembled a heartbeat with a future. The room exhaled around her. Camille looked at Sabrina, who was still holding the tube she'd placed incorrectly, and told her to go to the left leg, splint the femur fracture noted in the intake record, and keep it immobilized until orthopedics could take over. It was work Sabrina was trained for. It was work that mattered. Camille said it without any inflection that could be read as punishment because it wasn't. It was logistics, and there was no surplus of hands in this building tonight. Sabrina set down the chest tube, moved to the lower end of the table, and began. Martin looked at Camille across the patient's body. He had been an anesthesiologist for over 20 years. He had worked with attendings, fellows, and visiting surgeons from 4 countries. He opened his mouth and then closed it again because, whatever question he was forming, this was not the moment for it. Camille was already reviewing the unassigned rooms in her head. Operating room 4 held a 60-year-old man with a depressed skull fracture and a subdural hematoma that had been expanding since impact. The neurosurgeon on call had communicated that he was 40 minutes out at minimum. 40 minutes was not a timeline this patient had. The circulating nurse had been monitoring him alone, administering sedation and watching the neurochecks deteriorate. Camille scrubbed in, confirmed the location of the hematoma from the imaging sent up from radiology, and performed a single burr hole at the point of maximum pressure. The evacuation was controlled. The monitoring showed intracranial pressure beginning to drop within minutes. She packed the wound, gave the circulating nurse a specific set of post-procedure parameters to hold until the neurosurgeon arrived and moved. Operating room 5 was the last one. The patient there, a man in his 30s, had a femoral artery injury that had been partially controlled with manual pressure in the field, then lost during transport. A surgical tech had been maintaining direct compression and watching his pressure fall. The field was deep and thoroughly obscured by blood by the time Camille reached it. She found the vessel by anatomy and feel, working through the hemorrhage without the visibility she would have preferred, and placed the clamp at a point that took her longer than anything else she had done that night. 3 minutes. 4. The suction couldn't keep up. She held her position and kept going until the clamp was seated, and then she held it there while Martin adjusted the drip and the circulating nurse called the pressure. It climbed. Camille finished the repair, stepped back from the table, and for the first time in 3 hours and 14 minutes, there was no red light on any panel. No alarm she hadn't already answered. She went to the scrub sink in the utility corridor and turned on the water. The blood came off slowly the way it always did when it had dried at the edges, the folds of her knuckles, the creases at the base of her fingers. She ran the water as hot as it would go and worked methodically the same way she had done everything else tonight. She didn't look up when the door opened behind her. Bennett Ralston came out of operating room 1 at 3:40 in the morning, and the first thing he noticed was the quiet. After a mass casualty event, the hallway outside the OR suites had a specific texture, a heaviness compounded of exhaustion and grief, and the particular silence of people who have run out of things to say to the families waiting downstairs. He had walked out of operating room 1 into that silence hundreds of times. He knew what it felt like. This felt different. He checked the board. 5 names. 5 entries in the post-operative column. He read each one twice. Then he went to the ICU nursing station and pulled the operative records, not because he doubted what the board said, but because the board said something that didn't make sense, and Bennett Ralston dealt with things that didn't make sense by demanding documentation. What he found made less sense than the board. The drain placement in the thoracic case was textbook, not approximately textbook, not adequate, but precise. The abdominal closure had been done in anatomically correct layers, with suture tension that matched his own preferred technique closely enough to be unsettling. The burr hole was positioned within 2 millimeters of where he would have placed it. He stood at the nursing station with the records in both hands and worked through the options. Gavin Reese had not done this. Sabrina Knox had not done this. Martin Ellery was an anesthesiologist. There was no one else. Gavin was sitting in a chair outside operating room 2 with his elbows on his knees. When Bennett asked him what had happened, Gavin looked up and pointed down the corridor toward the utility area without saying a word. Through the small window in the utility room door, Bennett could see Camille at the sink. She was washing her hands with the slow, thorough attention of someone who had been doing it for a very long time. She wasn't rushing. She didn't look like someone who had just done something extraordinary. She looked like someone finishing a shift. He pushed the door open and stood in the frame. He told her he had reviewed the operative records. He told her he needed her to explain what had happened in those rooms. His voice had the controlled flatness of a man who was asking for information while simultaneously processing the fact that the information was going to require him to revise something significant. Camille turned off the water. She reached for a paper towel, dried her hands from fingertips to wrist, and said that the patients had been bleeding, and she had intervened. She said it simply without drama, the same way she had said everything in this building for 8 months. Bennett stepped closer. He looked at her hands, not at the technique of how she was drying them, but at the hands themselves. The calluses along the proximal phalanges, the particular thickening at the thenar eminence of her right hand. He had that same callusing on his own right hand, and he had earned it over a 20-year surgical career. He had never seen it on a nurse. He asked her who she really was. Camille looked at him for a long moment. Then she dropped the paper towel in the waste bin and walked past him out of the room. The answer, as it turned out, was in a database that required Bennett to wake up the hospital's administrator on call and invoke a records access protocol he had never used before. He called Miles Hargrove from the administrative office at close to 4 in the morning while the military database was still loading on the screen in front of him, not because he had finished reading, but because he had already read enough to understand that whatever Miles was about to say was going to require a response Bennett needed time to prepare. Martin sat beside him while he waited, because Martin had asked to be there, and because Bennett for once wanted someone else in the room. The database finished loading. Bennett read it without speaking. Camille Renner, Major U.S. Army Medical Corps, board certified in cardiothoracic surgery and trauma with a subspecialty focus developed in active combat environments. Graduated first in her class from Johns Hopkins School of Medicine. Served as lead surgeon at a forward operating base in Afghanistan supporting special operations units. A posting that, according to the performance evaluations in the file, she had requested and held for 3 consecutive tours. The commendations were extensive. The procedural volume was staggering. In a single month during her final tour, she had performed more damage control surgeries than most civilian trauma surgeons completed in a year, in conditions that the file described in the clipped, understated language of military documentation, and that Bennett nonetheless understood to be extreme. Then he reached the incident report dated the 12th of August, 2019. A suicide bombing at the perimeter. Mass casualties delivered to the medical unit over a 90-minute window. Camille had been operating for 22 hours straight by the time the last patient came in. The last patient's name was listed in the record. First Lieutenant Bryce Rener, her brother. Shrapnel wounds to the thoracic cavity, multiple fragments, bilateral lung involvement, aortic branch compromise. Camille had opened his chest herself. The record stated that she maintained direct cardiac support for 114 minutes before the injuries proved unsurvivable. Martin read the last section over Bennett's shoulder and didn't say anything. Bennett sat back in the chair and looked at the far wall of the office. He thought about the calluses on her hands. He thought about the way she had moved in operating room 2, the angle of her body, the quality of attention in her face, the absence of any motion that wasn't necessary. He understood now what he was looking at. Not just a surgeon who had trained and operated in conditions where the alternative to precision was not a bad outcome, it was a body bag. And she had been handing him instruments for 8 months. Miles Hargrove arrived at 4:40 in the morning with 2 attorneys and the particular energy of a man who had been woken from sleep and was channeling his displeasure into efficiency. He was the kind of hospital administrator who understood medicine primarily as a liability system, a network of protocols and documentation whose function was to protect the institution from the consequences of what happened inside it. He told Bennett what he saw. A nurse had performed 5 surgical procedures without a valid medical license. 5 exposure points. 5 potential plaintiffs. He said it in a calm, organized way that made it clear he considered the matter straightforward. Bennett listened to him without interrupting. Then he told Miles he was wrong. He laid out what he had found in the operative records, what the military database showed, and what Camille's board certification history revealed about her training before she had voluntarily surrendered her license. A Johns Hopkins-trained cardiothoracic and trauma surgeon with 3 combat tours had prevented 5 deaths in a mass casualty event where no licensed surgeon was available to intervene. Miles could call the police if he chose to. Bennett wanted him to understand exactly what he would be explaining to them. Miles looked at the attorneys. One of them said something quiet about prosecutorial discretion and emergency doctrine. The other opened a notepad. The door at the end of the corridor opened and Camille walked in. She had her bag over one shoulder and her resignation letter in her hand. Not the copy she had given Bennett, but a second one. She had prepared 2. She placed it on the table in front of Miles without drama and told him she understood the hospital's position and had no intention of complicating it. She would accept whatever referral he chose to make to the licensing board or the district attorney. She asked only that he not delay the ICU discharge paperwork for her patients, since their ongoing care had nothing to do with what she had done, and they had done nothing to deserve administrative complications in their recovery. Miles looked at the letter. He looked at Camille. Then he looked at Bennett in a way that meant this conversation was not failed, only deferred. Bennett picked up the letter and set it aside without reading it. He told Camille he wasn't accepting her resignation. He was putting her on administrative leave for the duration of whatever review the board required, and when that process concluded, he intended to bring her back not as a nurse, but as a physician with full surgical privileges and a position as deputy chief of the department. If the board of directors had objections, they could bring them to him directly. Camille said she wasn't sure she could lead a surgical team again. She said it plainly as a statement of honest uncertainty rather than a bid for reassurance. She had built a life that kept her close enough to medicine to be useful without putting her in a position where her failure would cost someone everything. She had built it with intention, and she wasn't sure one night was sufficient reason to dismantle it. Bennett told her he owed her something before she made that decision. He told her that he had worked alongside her for 8 months and had never once looked at her with anything resembling the attention she deserved. He had known her name and her shift schedule, and the fact that she anticipated instrument requests with unusual accuracy. He had not known anything else because he had not asked, because the structure of his assumptions had made the question feel unnecessary. He said this without softening it, because softening it would have made it easier to say and harder to hear. A system that had allowed him to be that blind to work beside someone with her history and her capability and her grief and see only a function, a role, a replaceable pair of hands, was a system that needed her inside it. When Bennett mentioned Bryce, the composure that Camille had maintained for 8 months came apart quietly. Not dramatically. What happened was more like a long-held pressure, releasing a change in her face, a change in her stillness. She said she hadn't left surgery because she had lost her ability. She left because she didn't trust what her hands might do the next time someone she loved ended up on her table. For 2 years after Bryce died, every time she stood at a scrub sink and closed her eyes, she felt his heart in her hands, the exact weight of it, the exact moment it stopped. And she couldn't find any logic in returning to work as though that hadn't happened, as though she hadn't stood in that tent for 114 minutes and failed at the only thing that had ever mattered to her as much as medicine itself. She had just saved 5 people, and she still believed she was a surgeon who had forfeited the right to a table. Bennett set her resignation letter down on the bench beside her, and he did not hand it back. The door opened again, and Gavin came in, followed by Sabrina. Neither of them had been summoned. Gavin had the look of someone who had made a decision while sitting alone in a chair and then acted on it before he could think himself out of it. Sabrina had the look of someone who had made a harder decision and was less certain about it but had come anyway. Gavin spoke first. He said that he wanted it on record, whatever record this conversation was producing, that he had been unable to act in operating room 2. And that if Camille had not intervened, the patient he was assigned to would have died while he stood at the table and did nothing. He said this not as an excuse and not as exoneration for Camille, but because it was the truth, and because the truth was the only thing he had to contribute to this room at this hour. He also said that in the 3 hours that followed, he had learned more about what it actually meant to make a surgical decision than he had in the entirety of his residency training so far. Not from a lecture, not from a simulation, but from watching someone work under conditions that removed every option except the right one. Sabrina took longer to speak. She had spent the past hour in the residence lounge, and whatever she had been doing there had worked something loose in her. She said that she had entered operating room 3 believing she knew what the patient needed, and she had been wrong in a way that stopped that patient's heart. She said it in a flat, factual voice that cost her something to maintain, and everyone in the room understood what it cost. She said that Camille had come in and corrected what she had done without saying a single word about the error, not then, not afterward, and had instead given her a task she was capable of completing so that she could still be part of saving the person she had nearly killed. She had been thinking about that choice for the past hour, and she couldn't identify another attending surgeon in this building who would have made it. Most would have removed her from the room. Some would have said something about it in front of the patient's open chest. Camille had done neither. She had simply moved forward and brought Sabrina with her. Miles turned away from the window. The attorney with the notepad had stopped writing. Bennett watched Camille's face while Gavin and Sabrina spoke. What he saw was not relief. It was more complicated than relief. It was the expression of someone hearing themselves described by people who had been present and paying attention, and finding that the description did not match the verdict they had already passed on themselves. Miles said into the quiet that followed that the situation was unusual. He used the phrase emergency doctrine again, and one of the attorneys nodded. He said he would need to review the full operative documentation before making any referral, and that in his preliminary assessment, the circumstances a declared mass casualty incident, no licensed surgeon available, imminent patient mortality represented a context that any reasonable board would weigh carefully. He said it in the particular way of administrators acknowledging that the ground has shifted without explicitly saying so. Bennett said he wanted Camille's reinstatement process to begin within the week. Miles said he would make no promises tonight. Bennett said that was fine and that he would follow up in the morning. After Miles and the attorneys left the corridor, held the four of them, Bennett, Camille, Gavin, Sabrina, in the particular silence of people who have been through something together and have not yet found the right way to name it. Gavin said he needed coffee and that he thought the machine on the second floor was still working. Sabrina said she'd come with him. They left without ceremony, which was the right way to leave. Bennett told Camille to go home. He told her the review process would take time and she should use that time for whatever she needed. She took her bag from the table and walked out. The ICU was on the 4th floor and she took the stairs. The hallway up there was dim and hushed, monitored by a single overnight nurse at the central station who looked up when Camille came through the door and then looked back down at her screen. Camille walked the length of the corridor slowly past the rooms she already knew by name from the intake sheets she had memorized at the start of the shift. She stopped at the 3rd room on the left. The young woman from operating room 3 was sedated, her breathing slow and measured against the rhythm of the ventilator. The chest drainage system beside her bed was functioning correctly. The monitor above her head showed a sinus rhythm steady and real. A man was sitting in the chair beside the bed with her hand in both of his, and his head was bent forward in the posture of someone who had been praying or weeping or both, and who had not yet found a reason to stop. Camille put her hand against the glass. The grief she carried about Bryce was not a thing she expected to resolve. She had stopped expecting that a long time ago. The expectation itself had been a kind of cruelty she'd eventually stopped inflicting on herself. She would always know the weight of his heart in her hands. She would always know the precise moment it stopped. That knowledge was part of her now as permanent as the calluses on her fingers, and no amount of time or distance, or one extraordinary night in a snowstorm, was going to remove it. But she stood at that window and looked at the man holding his wife's hand, and she understood something she had not allowed herself to understand for 2 years. The operating room had not become a place of loss the night Bryce died. It had always been both things at once, the place where she lost people and the place where she fought for them. She had been fighting in those rooms long before Afghanistan, and she had saved people long before she lost her brother on a table in a forward operating base while the world outside was on fire. The grief was real, and the work was real, and they had always coexisted in that space. The only thing that had changed was that she had stopped believing she was allowed to hold both of them at the same time. She thought about what Bennett had said, not the part about the job or the position or the review process, but the part before all of that. The part where he had told her the truth about himself, which had required something from him that she suspected did not come easily. She thought about Gavin's hands steadying once she had made the first cut. She thought about Sabrina at the lower end of that table, working carefully and without complaint on a task she had been given instead of a dismissal she had expected. She took her hand off the glass. She had not saved everyone she had ever tried to save. She would not save everyone she would ever try to save. That was not a flaw in her, and it was not a verdict on her worth. It was the boundary condition of the work itself, the one thing that never changed, no matter how skilled you became or how much you were willing to sacrifice. You fought for every single person in front of you, and some of them you lost, and you carried those losses forward into every room you ever entered after that. And you kept going. Bryce had not died on the table of a surgeon who had given up on him. He had died in the hands of someone who fought for 114 minutes and refused to stop until there was nothing left to fight for. That was not failure. That was the fullest possible expression of everything she had trained her whole life to be. Camille picked up her bag and turned away from the window. She walked back down the corridor past the nursing station and through the stairwell door, and instead of going down toward the exit, she went up. One flight. The door at the top opened into the surgical wing, and the scrub sinks were lit, and the instrument trays were already being restocked for morning by a tech working in quiet concentration. She set her bag down beside the lockers. She did not know exactly what came next. The review board, the paperwork, the process of reconstructing a credential she had deliberately dismantled. All of that was real and would not be simple. But she had found a vessel in total darkness by anatomy and by feel in the middle of a hemorrhagic field with no margin for error. She had always known how to find what she was looking for when it mattered. She had just forgotten for a while that she was still allowed to look. She sat down on the bench and she stayed there and she did not leave. There's something in Camille's story that most of us have felt at some point. Not the surgeries, not the battlefield, but that specific moment when one failure becomes the reason we stop trying altogether. When one loss convinces us we've lost the right to keep going. Camille didn't lose her skill the night Bryce died. She lost her permission. The permission she gave herself to still be who she was. And for 2 years, she lived smaller than she was capable of living because it felt safer than risking that kind of pain again. What brought her back wasn't a perfect outcome. It wasn't someone telling her the grief would go away. It was the recognition that carrying a loss and continuing to do good work are not mutually exclusive. That the most meaningful lives are often built not despite the hardest moments, but around them. If that idea resonates with you, if you've ever felt like one chapter of your story disqualified you from writing the rest of it, there are more stories like this one waiting for you here. Subscribe so you don't miss them. And if this one moved you, share it with someone who might need it today.